Well, hello, good morning, good evening, good night. It is Dr. Lana here. Welcome to Care and Thrive for all families, family legacy, and just caring. How was your week? We are on Saturday, we are live, we are talking to families and caregivers. It's been a rough week for some, a rougher week for others. And I know that today's topic, what we talked about, dementia, it's not the prettiest subject that no one really wants to talk about it. And so that's why we have to talk about it because that helps the entire family. We share, and what we share makes us, um, especially as family caregivers, the knowing about the condition of your loved one, knowing about the types of dementia, knowing that there are types of dementia in the first place. Well, how does that help you? Well, it helps, you know what, to do exactly what this channel is here for, putting your oxygen mask on first. And not just that, but having extra resources so that you, the family, the community can thrive. Because, hey, remember what I always say, this is time to grab a cuppa. Well, this is water tonight, hot water. Grab a cuppa, bring a friend, tell the whole family, watch with the whole family. Knowing, putting your oxygen mask on because you cannot do it alone. None of us can do this caregiving alone. And caregiving is a labor of not only love, but it is enough, plenty work. And enough is the Barbadian saying for plenty. So all the pages out there, hello, you know what I'm saying. So here goes in the other earring. The two cats, if you hear them, just ignore them. I am. So, dementia. Exactly. When I was presenting this, I'm like, you know what? You really need to start with a definition. And so let's start with a definition, shall we? According to the American Alzheimer's Association, dementia is a general term for loss of memory. I know most persons will know that. Loss of language problem, loss of language, construction, problem solving, and other thinking abilities, which are severe enough to interfere with daily life. And they also mention that Alzheimer's is the most common cause of dementia. Now, I know you're thinking, okay, so I thought it was just Alzheimer's. No. So it's the general term for that loss of memory. So that encompasses what doctors call senile dementia. And as a gerontologist, specialist gerontologist, you often, if you go to a doctor who is specialized in the study of older persons and their issues, which is what I do, you hear often they say, "Oh well, it's cognitive impairment," or it's which means it's the language and the processing of memory and so on. That's impaired. Or you may hear something like senile dementia or senile cognitive impairment. Why would you say it as a doctor so reluctant to say Alzheimer's? Why the doctor just can't give me like one diagnosis and let me go along? Because it's a little more complex than that. And so that's what we're going to talk about tonight or tomorrow, depending where you are. And then we're going to talk how knowing this helps caregivers. Important, right? So that's the definition out of the way. Sorry. So first of all, there's dementia there's and we often say, you'll hear a doctor say, if you hear it, well, at least you can say you know what I'm saying. There's the dementia of Alzheimer's type. There's the dementia of Lewy body type. So there's a dementia of, sorry, I think I'm just losing my voice. There's a dementia of the vascular, which is vessels, blood vessels type. There's frontal temporal type. And I mean, I sound like I'm, yeah, a bit complex here, but just hold on. There's a reason for this. Remember, I promised it will not be these complexities. This is going to be easy. It's more doable. And there is the dementia of that's mixed. Well, of course, in a medicine, it's like all mixed up. The brain is not going to follow one thing, what the Google says or what the book says. Then there are other types that we're uncertain of, and we just it's not fitting into one particular type or the other. Okay, so that's that. The Alzheimer's type, the vascular type, the Lewy body type, the frontotemporal type, or there's mixed, or there's other. So if you're taking notes, just take the notes of the different types. Just make a note. Note this out. There are different types of dementia. Really got to ignore these cats. So the dementia of the Alzheimer's type is probably the ones that you would know of the most. So I think what I'll do is probably talk about that one. All right. And so we're using mainly the information from the American Alzheimer's Association because they really, really have it have it very well nicely put together for us. So why spoil it? Alzheimer's. What is Alzheimer's disease? First of all, it's named after the gentleman who discovered the abnormalities in the brain, and Alzheimer, hence the name. So Alzheimer's, people call it different things, but it's the most common cause of dementia, so let's talk about it. And remember, it's memory loss and other cognitive impairment enough to interfere with daily life. So mom or dad or cousin or spouse or whoever was able to go to the store, able to remember that the stove was on and to make the tea, able to remember that how to take the garbage out, to brush your teeth, to remember what the conversation was about. So it's all of that, and that's 60 to 80% as far as the research goes. But it's not a normal part of aging. So again, with aging, yes, there are less newer connections. Yes, there's a delay in processing of information. Yes, there's not the memory that you used to have before, or the mood. Someone may change their mood from happy to sad, and it may change drastically. They may just go suddenly angry. And you're thinking, what's going on with mom or dad? Why are they changing their mood? What's going on? So that happens with aging. That can happen at any point. It's part of the aging process. Aging is not a disease, it's a process. So, Alzheimer's disease can also affect younger persons. So, remember, even as a caregiver, and it's not that caregivers don't want to add to the, you know, pile, but it is thought that those persons who are caregivers who do have as the main caregiver someone with Alzheimer's, they're at a higher risk of developing early onset, as in less than 65 years old, early onset dementia or Alzheimer's disease. Now, I don't want you to be too bogged down in all the things. It's just what's the differences and why you need to know. So I'm just going a little bit, maybe skimming the top, maybe going into a little deeper for some of the things. Alzheimer's is also progresses over time. Now, and the symptoms initially will be mild, but eventually, this is the key. So, older person who may forget, or who may not be themselves, or who may be frail and not able to walk as usual, or remember what they used to remember, or they get lost in the conversation. That happens, but they can live, and as they progress, it's okay. With Alzheimer's, it's different. You notice, and the progression can be as swift as in couple of months, or it can take years. And we know the expression is the long goodbye. Why is it that way? So much is unknown, but what we do know is that Brain studies of persons with Alzheimer's show these deposits. You may have heard of amyloid deposits. It's white deposits in the brain that seem to be damaging the brain as life goes on, removing and like stripping the nerve connections. The nerve connections is slower, but it seems to be like really worse. And so they mention symptoms of the forgetting, of not being able to even get out of bed sometimes after a while. That up to as long as 20 years, for some, 10, 20 years, 30 years, depending, uh, is a long goodbye sign. So what are at least some warning signs of Alzheimer's? There are 10, and we'll just talk about it, just briefly skim it. Memory loss that disrupts life. They can't plan or solve problems anymore. There's difficulty in completing familiar tasks. So, for example, Gran used to be the one who used to make all the cake, the one who knew all the ingredients to a T, and now she can't even remember where the what how much butter, or if there was butter in the thing. I can't remember what the bowl looked like. That and that's a progressive thing, and that got worse from year to year. That's one of the signs. Confusion. Where am I? One of the questions we ask persons is, do you know where you are? Do you know what time it is? Do you know who you're talking to? And that gets worse over time. They don't know, they're looking, there's a blank stare. That's the often thing we see. There's trouble understanding like visual images. So not recognizing where they are in time, or what's happening, and who's talking, what new words they're speaking, what's happening in the conversation. Judgment is can be impaired for certain. So you're thinking, well, mom used to never allow us to do that. Why is she making this decision now? Why, especially things like normal daily toilet, like bathing and wanting to go to the bathroom, they may do it inappropriately, or may want to do it in in a different time. So morning time they used to do, and now it's evening time, and they can't remember where the bathroom is. They're withdrawing from social activities. Remember remember this is progressive. Changes in mood and personality. Oi, sounds like a lot. Does it sound familiar? Well, that's Alzheimer's, and it's progressing. So they're losing tracks of dates, seasons, time, persons, where they are, who's talking to them. I know for certain they're family members and patients I deal with, I speak to. After a while, I have to say, do you remember who you're talking to? And many of them, some eventually come around and say, well, I know the face. I can't remember your name. And some then, I haven't seen you for a long time. And some definitely are. You can see them trying to remember what they can't. It's distressing, it's true. But these are signs in the family you can tell that someone have Alzheimer's disease. And remember, there are different types. So I also mentioned Alzheimer's. So dementia is the umbrella term for all the other things. So the dementia of the Alzheimer's type is what we just spoke about. Dementia of the Lewy body type. Persons have heard of this, but what is that? And that's Lewy, Lewy body. Again, from the other researcher who would have investigated and found it. You got to give people the props. So it was also found this time in a different type of scans of the cells of the brain of a person whom when they were doing research. And dementia with Lewy bodies. That's a progressive as well. All dementia is progressive, but to certain ways, in certain types. Dementia of Lewy body type is also progressive, but it's thinking, reasoning, and independent function. Hmm. How is that different from dementia of the Alzheimer's type? Well, in terms of, and this may sound strange, but you may be aware of persons who may act differently from day from when it's night. And that's like the nighttime change. Like, have they changed with the moon, or have they just changed because it's night and they're confused? No, it's actually interruption in their sleep pattern, interruption in their attention, interruption in alertness, interruption in how the brain is just processing things that they see. So this person has visual hallucinations. So they're seeing their parents usually, or they're seeing the person under the bed, or that person under the couch, or the person that came and took the garbage away, or there's somebody who's always taking my money. We say this in jest. Sometimes it may sound like we're saying it in jest, but it it's it can be very disruptive to families because it can feel as though they're accusing you of taking their things, or you're that initially you may have thought, well, somebody came over and took something because it sounds rational. But no, this is progressive, and they then start to definitely, especially at night, do some have some odd things that they say because they are seeing someone that you're not seeing. So it's a hallucination, a fixed but false sign of what they're seeing. They also may start to have signs that seem like Parkinson's. So the effect of the bodies in the brain starts to have them with a slow movement. They may have tremors, or they may be really, really stiff. So you're trying to get them in bed as a caregiver, and they get progressively more stiff. The other thing with Lewy body dementia is they have hunched posture, they may shuffle. So sometimes it can be confused with Parkinson's. And indeed, there's a suggestion that there's an overlap with Parkinson's and the Lewy body dementia. Even more complicated. So for caregivers, remember this is for you to know. So when the doctor is talking to you, or when you go to the doctor's office, or when you're learning it, or when you're trying to figure out what is going on with mom, dad, uncle, spouse, you're able to ask. The doctors are asking you so that they can figure out which one it is, and then you then can know what to look out for. So how to manage. So if it's confusion at night, for example, some people do better with a night light. That is a natural light that helps them to not be confused, or to keep lights on, or to definitely transition slowly from day to night so that they don't feel the abrupt change. But usually a night light is pretty good. When they interrupt in in the middle of the night, with the some may actually have very disruptive dreams, and then, as I always say, nobody can sleep because the dreams are so vivid, because they're in rapid eye movement where we have our dreams, and their dreams are so vivid they can actually like call out loud and scream. It was very disruptive and very disturbing for them and for you and for the family. The memory loss might not be as prominent as Alzheimer's, so it's more body structure, hallucinations, maybe inappropriate behavior, and especially getting worse at night. And behavior that and muscle weakness, rigidity, and shuffling gaits that looks like Parkinson's. With me so far? So we just done dementia of Alzheimer's type, the most common, dementia of Lewy body type, frontotemporal dementia. So front of the brain where we process all our thoughts and information, and then the side of the brain where we also process things such as temperature, being able to deal with hunger, thirst, that sort of thing. So in the what happens with that? So frontal, temporal, side dementia. Again, it's all nerves. It's just what the nerves are doing, and it's what's happening to your family member, to your spouse, to whoever is in the family. Now, I want you to not feel like, oh, we're never going to know. No. So there are little changes, there are subtle differences. They're all under the umbrella of dementia, which is memory and unable to process in usual activities. But there are little things in between there that distinguish it. So that's how family caregivers can know. And you can arm yourself because you know now what's going on. So frontotemporal degeneration. So it's degenerating. If the front part of your brain is degenerating, and that's where um, our uniqueness as human beings, in terms of being able to process complex behavior, in terms of being able to process our behavior in public and in private, this is the one that really changes persons and really can be disruptive because it's a behavioral change. Can also happen to persons in their 50s and 60s. It can happen as early as 20s and as late as 80 years old. So don't think for a minute that when we say dementia, we just mean one older person. No, no, no. That's why the knowledge is potential power because you use what you know. You may stop being able to form words. Language skills are gone. Speaking, writing, understanding. So whether the person, and many times persons think, and I do know of many who were professors of medicine, professors, teachers, doctors. No human being is immune to this. And they no longer know what they're saying. They no longer can process what they're saying. They don't understand words in a spoken sentence. They're just hesitant. They say the wrong way. They say the the sheep is in the fence. Well, if it's one sheep, that's fine. But if it's a flock, that flock of sheep, or those seven sheep is in the fence. You know that's grammatically wrong. And this is from a person who would never make that mistake. Hmm. So that's one. The speech is starts to get just confused. Disturbances of motor function. So what happens? They start to get progressively weak in their muscles. They're also stiff, but not so much as the other one, that of the Lewy body that can overlap with Parkinson's. So arms and legs tend to like make these funny movements. So where you're walking, your leg's supposed to go forward, the other go back, kind of like you're marching. But somehow now the right and the left leg going the same time, and you're gonna trip up. So that's where sometimes falls come in. And so be aware that fall risk in any person, older person, person with dementia, but especially dementia of excuse me, dementia of the frontotemporal type, they can have a higher risk of falling, let's just say. But it's really, and because they're unstable, they're no longer walking in the straight, they're no longer processing how they're looking. Eye movements are off balance, so they may not be able to see properly where they're going, not visually, but they just can't process what they're seeing is where they're going. So they need more, sometimes need more physical assistance. And that's where the caregivers can come in. Now, one rough estimate is that the majority of persons are between, we said, young as 20, old as 80. So the average is 45 to 65. That's the caregiving age average. So if you have a family friend, if you know of yourself and you're feeling like this, and you're feeling, I'm too young, the studies suggest please go see the doctor for yourself as a family carer, or you know of a friend, let them do it. Early diagnosis is really important. Age at diagnosis is an important clue to what type of this frontotemporal dementia is. Problems with speech, problems with getting lost even though you're in your familiar place, problems with hallucinations and delusions can also come and progress with this particular disorder. Hmm. Behavior changes tend to occur later. And I do know that behavior changes, like inappropriate behavior changes. So undressing when it's inappropriate, going to the bathroom when it's not an appropriate time, so they're doing it in a public place. That can really disrupt families. That can really put you on a stray. The other one that we mentioned was vascular. This is a little more straightforward, and it's usually having a definite, shall we say, at least you know what's happening there and what happened. So vascular dementia, blood vessels, vein. So did the person have a stroke? Did they have a partial a transient ischemic attack, TIA, like what we call a mini stroke, which is not mini at all. It's a warning sign that maybe there's a full on disruptive physically and otherwise, stroke will be coming on. So a decline in thinking skills because there's less blood flow to different regions of the brain. So if the brain is deprived of oxygen, imagine if you were deprived of oxygen. We're talking about oxygen mask. If you have no oxygen for a while, you're gonna get fuzzy. You're gonna not remember. You're gonna not be able to think. Any of us. But imagine this is happening because there's less blood flow to that particular area. And so what happens is that will kill the cell. It doesn't just disrupt them. If you see the kitties, they're in on it. They're having a good time. Um, they're my mascots. Don't worry about them. Ignore them. I am. So vascular dementia, inadequate blood flow, damaging and killing cells, but especially the brain. So not only did the stroke or the event, so if a person had a heart attack and it affected the blood supply to the brain, which also affected their thinking again, suddenly major blood vessels are blocked in the brain from a clot from the heart or from a clot from the brain or from damage and bleeding in the brain. Something that happened to the major blood vessels in the brain. Doctors call it vascular because it helps us to understand what happens. So you can may definitely be able to see it on the neck, on a CAT scan, a brain scan. And the thing about it is, again, there's another overlap with Alzheimer's and dementia with Lewy bodies, which is stiffness, which is progressive loss of awareness of where you are. But so what do you do? But remember, it's this is fewer people. This is a 5 to 10%. So thinking difficulties are the worst. Mild changes, like, and they would have had a stroke and said, you know what, since my mom or dad had that stroke, not behaving the same way. So you can tell the doctor that as a caregiver. You can recognize that when they start to make up words or say things or not tracking. You're like, you know what? This is not just older age changes. This is a particular thing. Let me see how I can help mom. Vascular damage symptoms after the stroke, confusion, disorientation, trouble speaking. So, what can you do? Speak slowly. Maybe not, it's one sentence at a time, one task at a time. And I remember a friend in in one of my classes in postgrad, she said, "You know what? If you're doing a sandwich, it may be as complex as tedious as you want to make a sandwich. So get the plate, put the plate on the table, get the fork, get the knife, take the bread. You know where the bread is? Okay, I'll get the bread for you. Get your cup. Do you want your cup? Get the water, the kettle, and you do that for them. And then, do you want peanut butter or normal butter? Don't give too many choices. Just say, I'm going to give you peanut butter today. Do you want to spread it? I will spread it one task at a time. So just, it takes time, it takes patience, but knowledge is, you're using your knowledge to actually help yourself so that you can know, how do I speak to mom? How do I speak to dad? Why are they having trouble speaking? Why are they not oriented? Is daytime? Why do you think it's night? Why they want to go home so much? Their previous home where they knew, because they're going back in time. Why are they having difficulty walking? Why are they having difficulty in balance? Why does one side seem weaker? Because they had a stroke. So remember, they may need more assistance as well. Multiple strokes over a time can cause the fibers to be more and more damaged. And the guidelines we have, they have switched, but in 2011, American Heart and Stroke suggested that a joint scientific statement, which include practice recommendations, raising awareness, so that we can investigate this more. So the bottom line is we need to do more. And there's several testing that goes on. Blood tests, CAT scan tests, any past history of strokes, any history of heart attacks, all those things that the doctors will mention to you. Especially if it's a younger person, it seems to progress worse and really disrupt the family. So we're going to get into, how do you do this as a caregiver? What do you do? How do you help the older person? And there's some that are general and some that are specific. and we don't want you to like hide away the older person. It's not a disease. We just need to know what's going on. So the last one I'll talk about is the mixed dementia. So mixed is as it as it sounds. Thus Alzheimer's coexisting with vascular, coexisting with Lewy bodies, and all three: confusion, not able to process conversations, not stiffness in movement, inappropriate behavior, not remembering who they are, who people are, where they're going, what to do. Can you imagine how that must feel in the early stages when they don't know what's going on, when the diagnosis can't be made because we can't pick it to one thing? Family members, caregivers, when you know that, or when you're uncertain, that creates so much more confusion. So the more you know, ask questions, even if the doctor hasn't asked. Say to the doc, or tell the doctor what you've seen. That helps us a lot. Well, doc, I've seen she's stiffer. I can't get her in bed, and it's not arthritis, or she's not remembering what to do. She's not remembering any of us. She doesn't. She's looking at us blankly. She's or he or whoever the person is. They're doing inappropriate things. They're not going. They seem confused at night. Nobody can do. They're having these bad dreams. Whoa, that's a mixed picture. And my heart goes out to those who have the mixed picture because the diagnosis can be complex, and the diagnosis is often not guessing game, but it's kind of like, let's take this, and then we put it all together. And unfortunately, some of these come at autopsies, and we really do respect those persons who have donated and have been a part of with donating to science so that we can learn more of this such unknown disease, of this such unknown and such disruptive disease in our lives. So, causes and risks. So we've dealt with the four: Alzheimer's type, Lewy body type, frontotemporal type, the mixed type, and then there are others which are much more complex. So we won't be discussing those. I know you're like, ugh. So we just want to know like what to do so you understand a little bit. Can it be treated? No. Most is managing the symptoms, managing what we see at the time, and then definitely having family discussions, discussions with the doctor. Recognizing that if it is a stroke, well, and the stroke came because the person was smoking or having excessive alcohol use from before, or they have a poor diet, at least you know what to do. So stop smoking, uh, and they're under your care, or have the community nurse come to care, then you kind of know, well, they'll help me out. We be having some help a little bit. Um, Smoking, things that are the risk factor for dementia of all types. So smoking, always, there's never anything good that comes from smoking. If you want to protest with me that smoking opens your brain, I've not seen any studies that suggest that smoking has helped with any form of dementia. There are maybe studies about certain medications, herbal or otherwise. At the moment, it's not suggested. If you we promise we're going to look into it more. There's much research going into things that can help, and there's research that suggests that other herbal medicines can help. But at the moment, the best you can do is uh, healthy diet. We say this all the time: healthy diet, no smoking, no excessive alcohol, movement, exercise, get them moving, puzzle games, word puzzles, family word puzzles. Hey, Pictionary. Remember, it's visual. So some need a visual reminder. Show them things that they had liked before and help them to recognize it. If their body is stiff, help them to move around. For you as a caregiver, for all of us as caregivers, for the whole family, get the children involved. So let them move around. Hey, you know what, Granddad? Let me move your legs. Hey, and it makes it fun. And trust me, older people really like children and animals around them, most of them. And so let the children, they really don't want to see the adults, the children, adults, that like us who just want to tell them, Mom, no, Dad, no, no, you can't go, no, no, no. Children have an open mind, and so we want to have the mind of a child. And remember, this person took care of us. Their brain has changed. It has now become more of a challenge, more of a family challenge. We understand that. I understand that. It is distressing to see someone that you love just not recognize you anymore. It's painful to see. It is absolutely painful to see. So I hope that this was some sort. If you have any other questions, if you have your experience, share in the comments below. Let me know. If you want to go in a deeper dive and you're feeling overwhelmed as a caregiver and you really are like, I don't know, half of what she just said, which is what happens at doctor's offices, mind you. And I need a little more. I'm happy to help. You can reach me at my link below, Lana and MD. Send me an email, Lana at Lana and MD. You can find me on Facebook, find me on Instagram, like, subscribe, press notification bell, tell a friend. Remember, there are things that we can do. We are not lost. This Alzheimer's, don't want to use the words. Don't use words like fight. Don't use. Let's not use words that make it seem as though it's out of our reach. We are a little bit more. So dementia is the umbrella term, loss of memory. It has different things. So you know what to ask. Make a list of what you want to ask the doctor for and about. And in that asking, you gain your knowledge. You get you feel more clarity. That clarity, hence the term clear, helps you to breathe better, helps you to know what to do better. Let's make that for the whole family. Have the children on board. Let's get movements, get the community. Speak to your community hub. What resources does your community have? I'd like to know. Does your community have resources for patients with Alzheimer's? Does your community have resources and practical help for persons who have Alzheimer's, who have dementia, who you're not certain of, who you need help with? Maybe you just need a physiotherapist. Maybe someone in the family is great at massages. Have them come in, sail up, brother, sister, or at least you can do it on Zoom. Anything can be done on Zoom these days. Anything can be done on FaceTime. You just look at the person, have a telemedicine with the doctor. There's things that can be done. Diet wise, it may be more specific for others than other types of dementia than others. But in general, caregivers, remember it's about you as well. It's about your learning to have enough rest, your older one having enough rest, exercising, make time to exercise with them, eating healthy foods, make the foods for the whole family. Find out from doctors, do they need more minerals? Does my loved one need more protein? Do they need to have do they need to stop eating at a certain time of night? What if they have diabetes? What if they also have hypertension? What if it's mixed? Is there time that I is there a diet sheet or a nutritionist referral? Ask for help. Ask for help. Ask for help. The help is there. The team around you and the older person is a big team. Social worker, primary care, the primary caregiver, the dermatologist, myself, the dentist, everybody. Let's get on board. Remember, there's a lot of Alzheimer's where persons eventually forget to do basic things in life. And so we want them, yes, to be as independent as possible, yes, um, to feel that dignity that we're not just, oh, come let me change your private areas, or let's wash your private. That's it's a process. So let's learn about it. Let's have some workshops, have a community hub, bring everyone together, not just doing it in your families, not just doing it for you alone, just Googling in the middle of the night, you have your work, you haven't got a clue. Bring everyone in. I'm happy to help. As I said, reach out to me, like and subscribe, press notification bell. We're gonna be bringing more. Um, there's always more that can be discussed in not only family caregiving, but in terms of what happens when. What happens when family member has something that is really deep? How do we find out more? So, whew, take a deep breath. Take a deep breath. Drink a cuppa. It is water. It's cold. I'll warm it up when we're done. So, this has been helpful to you, and you want to take a deep dive further where I can be reached, Facebook, Instagram, send me an email. That'd be great. I'm loving talking with you. I hope this was helpful. And you now know you may have a little more insight into, oh, that's why my loved ones having this behavior or this behavioral change. Don't isolate yourself. Don't isolate them. Don't isolate the family. Bring us all together. Let's share. Let's bring our communities together. Let us do that for ourselves. Oxygen mask on first. Remember, thank you so much for sharing. Care healthy. Age healthy. Age happy. Age healthy. Take care of yourself. Put your mask on first. Let's do this as a family. Let's bring our generations together. Let's make that legacy that our older ones who took good care of us, that legacy they brought down, let's pay it forward. They paid it forward to us. Let's pay it forward. Until we see each other next time, thank you so much. This has been great sharing with you. Until we meet again, and tell me, what would you like to see me present next? What topic would you like to see presented next? We'll be doing interviews, be mixing it up, and just let me know. Send in the comments. Let me know what did you want to know more about. But until then, care healthy, care happy, care like fine wine, not too much, and stay hydrated. Drink some water. Know when what the signs are. Knowledge, know, make your notes. Make notes when you go to the doctor's office, and let's do this together. Have a fantastic morning, evening, or night. Love, 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 all heart. Have a fantastic one. Until we talk again, take care. Bye bye.